The second major benefit of intermittent fasting is improving your insulin sensitivity. This means that whether you're pre-diabetic or type 2 diabetic or have fatty liver, all of those parameters will improve because your body is able to utilize insulin better. And this is because whenever we eat food, we raise our insulin levels. And if you're eating all the time, the insulin levels stay high all the time. If you're spiking your insulin all the time because you're always snacking and eating, eventually your body starts ignoring it. And that's when it's starting to become resistant. The other reason your body ignores insulin is because remember, the job of insulin is to push energy in the form of triglycerides, fat, glycogen into stores, into your fat cells, into your liver cells, into your pancreas. And if those areas are already full, so if the liver is already full of fat and the fat is actually now damaging the liver, if the pancreas is now full of fat and the pancreas cannot secrete insulin anymore and you're becoming diabetic, well, the body starts resisting insulin. It starts trying to stop sugar from being able to enter into those cells, to protect those cells. That then leads to sugar staying high in the bloodstream, which then leads to high sugar levels in diabetes. So if you do fasting, then your insulin doesn't spike, your sugar doesn't spike, your insulin levels start coming down. You start burning that fat, which is stored in the fat cells, in the liver cells, in the pancreatic cells, and so the insulin sensitivity starts getting restored. But in this study, they demonstrated that even without weight loss and without any calorie restriction, simply consuming your calories within a time window and fasting for 18 hours reduced blood pressure, improved insulin sensitivity by 20 to 30%, despite identical calorie intake and no weight loss. Fasting is magical, but there are other ways of getting that same magic as well. And here I'd like to highlight resistance training and building muscle. Building muscle, because muscle, remember, is the biggest sink of sugar. When your sugar spikes up in your bloodstream, the first place it wants to go is inside your muscles, because your muscles can store that sugar in the form of glycogen. But in the resistance training group, they saw a 46% improvement in sugar uptake within the muscles. They also saw an improved expression of what's called GLUT4 transporter. This is the transporter which transports essentially sugar from the bloodstream into your muscle cells and into your cells. And so while fasting is incredible for improving insulin sensitivity, so is resistance training and building bigger muscles.